And we'll get started. So the purpose of this session is to discuss conflict of interest, and we've affectionately titled it What Every Nurse Planner Should Know. If you are on the line, if you can just mute your background when you're not talking, that'd be great. For today's session, it's going to be Kelly Schweitzer and Jessica Zubak. So Jessica, feel free to chime in as we go along.
Hi, guys.
The requirement for successful completion of this is to watch a webinar and pass a post-test. And for those who are watching this taped, this session is good through mid-February of 2021. The outcome for this session is that 100% of learners will have knowledge needed to accurately assess for COI and their continuing nursing education activity work, as evidenced by passing a post-test with a score of 80%. We have some references. Please go to our website, ohnurses.org, under the Education tab. There's our conflict of interest decision tree and our COI forum. I would really suggest, if you don't have those, to go grab those, especially if you're watching this taped. It'd be great to have those as resources as you work through this material. There's also information about COI within our approved provider manual. And then the core curriculum for nursing professional development is a great resource. And we here at ONA also use the ANCC Primary Accreditation Provider Application Manual. So to get started, we're going to talk about what COI is. And for the purposes of today, that's the main purpose of our discussion. But we also want to talk about it in light of the larger context of content integrity. So as this diagram shows, content integrity, or if you think about it kind of like an umbrella and what follows under that umbrella. So you have this large section of content integrity, and then there's several things within that umbrella. One is managing conflict of interest, which, like I say, that's the purpose of our discussion today. But also within content integrity is freedom from commercial control. So not having commercial interest organizations, being clear about financial support in the terms of a commercial support agreement, and having it clear about they are not controlling the educational content. And that if money is given, that is for content, they have no control over the content. And then there's specific rules related to how you manage that. The other concept of content integrity is fair, balanced content without bias. So this is presenting different aspects of a situation. For example, an activity on medical cannabis. It's not about whether or not you agree with the use of medical cannabis. It's about, are you going to give fair, balanced content with the pros and the cons, patient implications, those kinds of things. So with all of our activities, we want to present fair, balanced content and not have a specific bias on the part of the presenter. The final consideration in the content integrity umbrella is freedom from promotion. So this is keeping any sort of giveaways, things that have commercial interest logo, those kinds of things, away from the education space. So giving learners the choice as to whether or not they take the bag, whether or not they accept the free promo item, those kinds of things, that it's not forced upon them in any way. So that's what we're talking about with freedom from promotion. But because COI is the main thing that often trips folks up, and we get the majority of our questions around COI, we're going to concentrate on that. But please know that the principles within this presentation of how to manage COI are also true under the other umbrellas. For example, when you're looking at slides from a presenter who, when the content is not about products that can be used on or consumed by patients, you're still going through that same process, making sure that, there's no bias, and if there needs to be slides change, those kinds of things. It's similar to the resolution process that we go through with COI. So here we go. So the three main components of conflict of interest are that the individual has the ability to control content of the educational activity, whether or not the individual has a financial relationship with a commercial interest, and a commercial interest is defined as a company that makes, sells, distributes products that can be used on or consumed by patients. And then, are the products or services of the commercial interest relevant to the topic of the educational activity? So one thing that we want to talk about first off the bat is if there are no products or services of a commercial entity relevant to the topic, it is impossible for anyone to have a COI for that activity. So Jessica, what are some good examples of activities that have no products or services of a commercial entity of which you would not have to get COI data for?
The first one I usually think of is leadership or mentoring, precepting, something like that. So you can have someone who is an expert on the topic of leadership, but they're not discussing any products at all that are related to patients. So their COI data isn't really relevant here because that's not what the content is about.
Right. So therefore, for that leadership presentation, collection of COI data from planners, presenters is not necessary. Another good example is this activity that we're doing right now.
Exactly.
So we have a space in our activity doc template for the nurse planner to document that decision and the rationale. And it's actually a sentence that says, this particular activity is not about products that are consumed on or used by patients. Therefore, there is no way for there to be a COI, and the nurse planner signs that. But just as we had at the beginning of this presentation on the disclosure slide, you still need to disclose that there's an absence of COI. So we still have that sentence, there is no conflict of interest for anyone with the ability to control content for this activity. So I'm going to take a moment now for those who are on the line. You can feel free to unmute yourselves and ask any questions related to what we've just presented on this important note slide. So does anyone have any questions or thoughts before we continue on with the presentation?
The only thing I'll say here is that we see a lot of times nurse planners and planning committees getting the COI data just because they want to be on the safe side. Mm-hmm. But I guess what we want to stress here is that it's really not too difficult to take a couple minutes and figure out if it's even possible to have that COI. It makes it easier on you, on your speakers. It's less back and forth, less paperwork. If you don't need that data, you don't need to put yourself through that extra step.
I'm so glad that you said that, Jessica. And I'm in agreement. So I know there are lots of approved provider units, lots of nurse planners who get COI on every activity because they just want to have the same process for every activity. That is completely fine. If that's what you are doing, you can continue doing that. My word of caution, though, is that when you have that process, like Jessica said, for some of your activities, you're creating more work for yourself. You are creating maybe a barrier for that speaker because they have to get their COI form to you, make sure it's signed. You as a nurse planner have to look through that, do resolutions, those kinds of things, which really there is no resolution for that, and signing data and storing all those forms. But I talked to many a provider unit, many a nurse planner who's like, nope, I still want to get the data on every activity. And you have the absolute right to do that. We are just big advocates for cutting down the paperwork where you can. Mm-hmm. And this is a prime example. Think about Jessica and I, the majority of our programs, there's no way there could be COI. We do nurse planner programs.
Right. Well, and even when we don't, like for an example, a conference that I'm planning right now, there's only, I think, 2 presenters out of the whole 2-day conference that could possibly maybe talk about products. And so when I was making my little chart and spreadsheet on speaker agreements and whatnot, I just wrote, -COI next to their name. So I knew who I needed to get that data on to be on the safe side, who needed that extra form. We actually removed it from our speaker agreement because if it's not relevant, then our speaker doesn't need to put all that information, and they don't know that. Mm-hmm. So we've tried to make it as easy as possible, and that's just the process that we use. But definitely, if you have a better process for that, go for it. My whole motto is not making it harder than it has to be. So that's just our 2 cents about that.
And just to clarify too, with that activity that Jessica was just speaking to, so of course, because we had 2 speakers that had potential for products, we also had to get COI data on every person in our planning committee who had the ability to control content. And we're going to go through that as we talk through these processes.
Right.
So why does COI matter? Why do we care about conflict of interest? Because a financial relationship with a commercial interest creates the opportunity for the individual to slant the activity towards the products and services of that commercial interest. And I know there are great speakers out there who work for drug companies, who work for other types of commercial interest organizations, product companies. And I have had folks be like, they're so great and they're PhD and they present nationally, they have utmost integrity. I'm not saying that they don't have integrity. It's just that the standards are saying that if they are an actual employee, that they cannot present. And one of the reasons why is it creates this opportunity for the individual to slant the activity towards that products or services, sometimes even without knowing. Think about the fact that we all say Kleenex and not tissue. Okay, without knowing, we're going towards the products of this particular company. And that happens more so with folks that actually work for those companies or the companies themselves doing the slides, the presentations. Also, that individual has the ability to accrue financial gain from any additional business acquired by the commercial interest. And unfortunately, these factors unfairly jeopardize the educational experience for the learner, right? We've all known, heard about, our parents have gone to. Think about when a physician, a nurse, somebody goes to an activity by a drug company. They come away thinking that's the best thing since sliced bread sometimes, and it might be, but we just want to create an environment where that is not a part of the educational experience for our learners, okay? And if we're going to award contact hours, we need to do our due diligence and evaluate COI and make sure that employees of commercial interest organizations are not speaking about content that's relevant to their commercial interest organization. So I kind of quickly stated the definition of commercial interest. So here it is in writing. Again, this is also on your COI form, and this is the reason we advocate for the form so that it's really clear what definitions we're dealing with. Because if you just go out and you ask 10 people, do you have a relationship with a commercial interest? They may or may not know what you're talking about. So just so that everybody's on the same page, we want to make sure that when we're asking those questions, that we have this definition, that a commercial interest, according to the ANCC, is any entity producing, marketing, reselling, or distributing healthcare goods or services consumed by or used on patients. Did somebody have something they wanted to say with that?
I'll just chime in here again for this one. Definitely including the definition, but I've found that sometimes even with the definition, some organizations or speakers still aren't really clear on what that means. And so it might be helpful to have a conversation with them if you think, they might be potentially reselling a healthcare good or a service, just kind of chatting with them about more about their company or more about what that relationship is, just to make it more clear, because sometimes that's a lot of words and you just want to make sure you're doing your due diligence, that they really understand and covering all your bases.
Yeah, so thanks for that, Jessica. That's so true. So you could be inviting a dermatologist to come speak on melanoma, and you've never been to that dermatologist's office. He or she reads this statement and says, nope, no relationships. Well, then once you start talking to them, or maybe you go visit their office, you're like, hey, wait a second. I see creams and gels and all this other stuff for sale in your lobby. You pretty much, are you distributing healthcare goods or services, things that are used on patients? Oh, yeah. It
Yeah.
happens.
Yeah.
And the whole idea, exactly like Jessica said, you're doing your due diligence. So if somebody says no, you've looked at the website, whatever, it appears as far as the data collection that you've done a really good job talking to them. They're saying no, no, no. And then 6 months later, you realize that, hey, maybe they are. You know what? You did your work. You have documentation. So don't beat yourself up if you're listening to this and you're like, oh, wait a second, I never did. Oh yeah, that dermatologist. And I don't want to throw dermatologists under the bus, but that's just the one example that I really
Yeah,
have.
it's a good example and you can apply that basic situation to a lot of things. That's not their primary business, but it's just something that they also sell in their organization.
Right. And then the other bullet point, which is really the harder work, right? They could also be an entity owned or controlled by such an entity. So think about CVS Minute Clinic. So you've got a nurse practitioner whose primary employer is CVS Minute Clinic. Well, they're owned by a big commercial interest organization. CVS makes their own Tylenol, all those kinds of things. So, it's a little different than having a nurse practitioner who works in a private practice office who probably doesn't have a relationship with a commercial interest organization. So it's not enough to just put the form in front of the speaker, content expert, other planning committee members, and just having them say no and you being like, okay, they said no, I'm done. Because I've had this happen to me more than once. They said no, but then you know how at the top of the form it says, who's your employer? Right there, their employer, who they're employed by, totally shows me that they work for a commercial interest organization. So they are not even really reading that form. Like Jessica said, it's good to have the conversation. And sometimes things come up. Also, and we'll share this in other slides, it's not just about assessing that content expert speaker, it's also about their spouses. At least for the last 12 months. Okay. And I will have that in writing. I just felt like it needed to be said right now. And I apologize because I tend to talk ahead of my slides sometimes. Okay. Here we go. Who is the individual? Who do you need to assess COI data on? It's anyone with the ability to control content for the educational activity. This includes nurse planners, planning committee members, content experts. Please note that a content reviewer is not a member of the planning committee, but if you are using a content reviewer, you want someone else to look at this particular speaker's slides, those kinds of things. Well, if those slides are about products or your activities about products, then they also need their COI evaluated. The speaker, the author, the instructional designer. So, if you have someone who wants you to give the content to them and they play around with it and they create cool quizzes and little interactive things, you're going to need to assess them as well. So who don't you need to assess? You don't need to assess the admin who maybe is only putting in data of who attended your program or whoever is only getting the food or securing the room. So if they don't have anything to do with content, you don't have to assess their COI because there's no way they're going to have any effect on the program. So what is the process for assessing for conflict of interest? The first step is to be sure the nurse planner has no COI. So how do you go about doing that? So the nurse planner needs to complete their own COI form, acknowledging any relationships with commercial interest, including her spouse for the last 12 months or his spouse for the last 12 months. And then someone else with knowledge of this process reviews the data. So that could be another nurse planner within your provider unit or that you know, maybe even your boss, another member of the planning committee. For Jessica and I, this could be she assesses mine, I assess hers. And then if a conflict exists, the nurse planner cannot continue with this activity, okay? They should not. It's really a difficult one to resolve, right? So the best bet would be for a new nurse planner to be part of this activity. If the nurse planner does not have a conflict of interest, then you keep going on with the planning. And then that next step then would be for everyone else to be assessed, right? So then the nurse planner collects data. And I just want to really emphasize here, throughout this presentation, we talk about the COI form and the use of the form. But I also really want to reiterate, kind of similar to what Jessica was talking about, it's not about the form, it's about the data. So if you have another form of data collection that works and that truly assesses COI, that is fine. I've had folks ask me, is it okay if I do it in a SurveyMonkey survey so that I have all that data in one place? Sure, good idea if that works for you. Is it okay if I use an Excel spreadsheet and I I put on that spreadsheet, I had a call with this planning committee member, I assess there is no COI, and move on. Sure, that's completely fine. Please note, if you are using something other than the form, then you have to have some way of documenting your resolution process when a COI comes up. So if you're not, that's what's the beauty of that COI form, is that not only is there the data from the person that's being assessed, but then also the resolution process of the nurse planner. So everyone completes a form. The nurse planner evaluates the evidence to determine if there's a presence or absence of a COI. Maybe he or she has some questions. Maybe they're going to look at, like I said, who the employer of this individual is, maybe do a web search on that particular person. Maybe questions to the individual. Sometimes I've seen where this has come up with once they get the slides from the speaker, they're seeing certain things, that there's certain things that are being talked about that creates a question in the nurse planner's mind, and then they evaluate further that way. Any questions about that? Okay, so what are the types of what are the types of financial relationships that we need to be concerned about? So first off, employees, so direct employees, the drug rep, a pharmacist working for the CVS. So an employee of a commercial interest can never be involved with an activity that pertains to his or her field of employment. So what about non-employee relationships? Well, they may be involved if the conflict of interest is identified, resolved, and disclosed to the learner. So what's an example of a non-employee relationship? Speakers Bureau, research funding, consulting, maybe volunteering, those kinds of things. Now, what's important is that, I apologize, I got ahead of myself again. How you can know if it's an employee versus a non-employee, for sure, is you ask the person filling out the form, do you receive a W-2 or a W-9 or a 1099? So if they are a W-2, then they are directly an employee of that organization. If they receive a W-9 and it's Speakers Bureau, those kinds of things, like I say, that conflict of interest can be resolved. You can go through that resolution process. Now, that being said, we want to make sure that we go through the 3-question process with the employee versus non-employee. We'll get to that in the next slide. So these relationships apply to anything currently in effect or that have been in effect within the past 12 months. So and so was a drug rep for such and such company. They're no longer employed by them. They're now employed by your institution. Once that relationship has been longer than 12 months ago, you're good to go. Also, like I've been saying, it applies to the spouse or partner of that person. This also applies if the person has individual stocks. It does not apply to mutual funds. My gosh, we would all be in a data minefield if it did, right? Who knows what's in all these mutual funds that we may have in our portfolios. But if they say that they have a stock with X drug company, then, is that resolvable or not? And many times not, especially if the activity is about that. It's not if the activity is about that particular product. So here's that 3-question process, like we've said, that we go through with each of our activities that have content that are about products that can be used on or consumed by patients. So are we doing activity that is about something the patient can eat or wear? Then we go through and talk about and work through assessing COI. So the first question you have to ask yourself is, who do I need to give all these forms to, right? So we're like, who has the ability to control content for this activity? And then the second part of that is assessing whether or not he or she has a financial relationship with a commercial interest. And then finally, is this activity, is the content of this activity related to that commercial interest relationship? So if you go through and you have a yes to all, yep, Sally has a relationship, Sally has the ability to control content. Yes, Sally has a relationship with a commercial interest organization. And yes, Sally's content is related to that commercial interest organization. You must go through a resolution process if possible, or not award contact hours for the activity. That's your other option. If you, are seeing problems with a certain drug and your nurses don't have knowledge of this drug and the only person available is the drug rep, have that drug rep give the education. You just can't award contact hours for it. That is an option you have when it comes to commercial interest organizations, okay? Because a lot of times we do need that education. We do need to know about that IV dressing or that catheter or whatever it is. And that particular rep is the best person for it. That's great. Just you can't award contact hours for it. It's no longer an activity that you're documenting and awarding contact hours and certificates for.
I think the other piece of this too is don't be afraid to resolve or try to resolve a COI. If you find someone that's an expert speaker on a particular thing, and Kelly and I have done this in our own programs, look at their slides, have a conversation with them, educate them on what criteria is, and see if it's something that you can resolve before you automatically discount them as a speaker, because they might be the best person for the education that your learners need, and some of these things can be resolved.
Yeah, that's especially true. Like we have one recently where we're working with the Speakers Bureau person. And, we had to review her slides and go through a couple of things. And so, it's going to be okay. But if she would have refused to remove trademarks, those kinds of things, we wouldn't have been able to use her. Right. But we went through that resolution process and it's working. Good point. So we have some examples that we would like to work through and see how it's going with all this that we've presented. So the first question is, this nurse planner for an activity on women's health is the author of an article that recently appeared in a peer-reviewed nursing journal on the topic of osteoporosis. So what do you think? Does this person have a conflict of interest? And you can unmute yourself and share your opinion, okay? I got crickets. Is anybody going to offer up their opinion?
Hello.
Hi.
Hi, it's Pam. How are you?
Good, good.
Well, it sounds like this person's an expert if she wrote an article,
Right.
but is she really going to benefit from speaking? I would say it wouldn't be a conflict.
Okay. Anyone else? What are your thoughts? So let's work through it a little bit. So do we have enough information with just this sentence to know whether or not we have a conflict of interest? Do we know whether or not this person has a relationship with a commercial interest organization just based on the data that we have here? I don't think we do. What I want to highlight is exactly what you said, Pam, that the fact that she wrote a peer-reviewed article in a nursing journal is excellent. We want those kinds of folks presenting at our activities, right? Like you say, they're the expert, right? That in and of itself is not a conflict of interest. But because that's all we know about this particular speaker, we don't know enough to assess whether or not she has a COI. But excellent, you're absolutely right. With just that information about that she wrote a peer-reviewed journal, then we need to investigate a little bit more. Now, this is where we get into that content integrity umbrella, and we want to make sure that she's going to have fair, balanced content, right? So say she does not have any relationships with a commercial interest organization, you're good to go. You're going to have her present and everything. But then in maybe looking through her slides, getting ready for your conference, you notice like, oh, her only reference is her article. Now that becomes a little bit of a problem. So that's where you would do that work of like, okay, we need to worry about content integrity here. We need to have fair, balanced content. Does that make sense?
Yes.
Perfect. Okay, so Tom Jones is invited to speak on the topic of heart disease in patients with diabetes. He shares that he's on the Speakers Bureau for Eli Lilly. Does he have a conflict of interest?
Yes, very much so.
We both say yes.
Okay. So what would you do with this person who is on Speakers Bureau for Eli Lilly talking about this topic?
Education, Gina can help you.
I'm sorry.
That's okay.
What did you say?
I said, okay, so you've got this Tom Jones, who's on the Speakers Bureau for Eli Lilly. You've identified that he has a conflict of interest. So what would you do?
Okay.
To see if we can make that okay.
Yeah.
I guess we'd have to find out exactly how he would benefit, if at all, from speaking.
So yeah, so he would, he's been, had education. He's obviously some type of content expert that he's on the Speakers Bureau for Eli Lilly. So this is where you would go through one of those resolution processes that's on the COI form. So kind of like what Jessica and I were sharing earlier, you would talk to him about that his slides need to be free from any types of logos, trademarks, those kinds of things, that he has to present fair and balanced content, that while he can talk about, treatment of diabetes and prevention of heart disease and that kind of stuff, he cannot speak specifically about Eli Lilly's drugs that they have. It has to be a fair content there. So then you would receive his slides, look through his slides, or have a content reviewer look at his slides and, yep, he has no trademarks. It looks great. He's not self-promoting. And then what you would have to do is then disclose that to the learner. And we'll show you that on a subsequent slide about how you disclose when someone does have a conflict of interest. You have to say, there is no conflict of interest for anyone with the ability to control content for this activity except Tom Jones, who's on Speakers Bureau for Eli Lilly. You do not have to tell your learners how your resolution process, how you went about doing that. You just need to let them know that there was a conflict of interest. Also, this is a good point to talk about how it would not be appropriate for Tom Jones to stand up in front of the audience and say, hey, I am on Speakers Bureau for Eli Lilly, but I'm not going to, I'm going to have fair, balanced content. I'm going to present without bias. Because himself, having himself get up there and say that, you've actually promoted Eli Lilly a little bit and then put in the minds of your learners like, hey, this guy has a conflict. He's probably going to be biased and all these kinds of things. You've put all these questions in your learners. Does that make sense?
Kelly,
Yes.
the other thing I thought about when I first read this question is I would want to know, is this presentation on the pathophysiology of heart disease? Is he even talking about treatment at all? Because then that kind of changes how your data collection and resolution might go. If he's not talking about anything to do with treatment, you've got a different situation on your hands.
That's absolutely right. So thank you so much, Jessica, because I went down one path, but you're absolutely right. There is another path that this could go on, right? So Tom Jones is on the Speakers Bureau for Eli Lilly, and you've asked him to talk about heart disease and patients with diabetes. And like Jessica said, he's only going to talk about the pathophysiology. Well, now he doesn't have a conflict of interest. There's no way he's going to speak about products that Eli Lilly has when he's only talking about pathophysiology of heart disease. So therefore, it would look a little different. You would go through that 3-question process of, hey, yes, Tom Jones has the ability to control content. Yes, Tom Jones has a relationship with a commercial interest organization. But no, his content does not relate back to that commercial interest organization. Therefore, there is no COI. There is nothing to disclose. Does that make sense? I hope it does. It might have put some questions, but that's going through that.
Yeah, it does. It does.
Okay, good. So Ruth Wilson is on the agenda to present at a conference on precepting. She states that she does not have any financial relationship with commercial interest. However, she provides you with a bio sketch to be used in her introduction, which includes the fact that for 5 years she was a manager at Wyeth. Does she have a COI? So when we go through our process, she, yes, has the ability to control content. She, yes, potentially has a relationship with a commercial interest organization. We're not sure with the information gathered here as far as was that relationship within the last 12 months. But then our next question is the topic that she's presenting on related to that commercial interest organization? The answer is no, because she's talking about precepting. So therefore, she does not have a COI. So here it is again, the 3-question process, how you go through each step, looking at who has the ability to control content, who has a financial relationship with a commercial interest, and whether that content of that educational activity is related to that commercial interest. If any of those questions are no, you do not have COI. If all of them are yes, then you do. Sarah Jackson's on the planning committee for an activity on caring for patients with hip replacement surgery. She shares that she has received research funding from a company that makes artificial joints. Does she have a COI?
Yes, she does.
And so again, based on this information, the caring for patients with hip replacement surgery, it's pretty possible that she is going to talk about the joint itself. But back to what Jessica shared earlier, maybe not. So that, again, you would have to go through that process of, is she really going to talk about the products of that commercial interest organization in order to determine if she truly does have a COI? And then if she does, if it's like, yes, she's going to talk about with this particular, after this particular surgery, this particular joint, you have to do this, this, and this. Or, when you have this other type of joint, you're going to do this. Then you would have to go through that resolution process and look at the slides, have an outside reviewer, whichever one of those resolutions that you take into account, and then disclose to the learner about Sarah's COI.
Can I ask a question?
Yes, absolutely.
So say if you determined that Sarah was just going to talk about the care of the patient post-hip, and she wasn't going to refer to her company or that specific hip joint or prostheses.
Mm-hmm.
But say in her talk, her presentation, somebody asked her a question which she can't answer because they're asking a specific question about her company's prosthetic. Would she have to decline answering? Does that make sense?
I know what you mean. So I've seen presenters handle this a couple different ways. In all honesty, you don't want to, what's the word? You don't want to hurt the learner. You don't want to stop the learner from asking questions during an educational activity. And they don't know that Sarah's received research funding because you've determined there is no conflict of interest, because as far as the presentation, everything, she can answer a question. Other ways that I've seen that handled is because of their fear of not wanting to have slanting the information. They can say, and I'm totally fine with this, advocate for this as well, as we can talk about that after this session. And I think that's completely appropriate as well. I had that in a session I was at once where it was more about, again, not conflict of interest, but more freedom from promotion, because this particular product that this person worked for was not a product for a patient, but yet it was a product that us educators were really interested in. It was a simulation software. And it was really cool. Like, she was telling us about this particular facility and what they had done with the software and what their learners' outcomes were and everything. So we're like, we want to know specifics, right? Like, what's the software? What does this look like? How can we get to this? And da, 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 da. She's like, well, we'll have to talk about that after the actual presentation of what the software did for our learners. And I think that was the absolute correct way to go with that, because she did not want to promote one product over another in the specific learning environment. Does that help? Does that answer your question?
Does.
Okay, good.
It does, because I could see that happening.
Right. Yeah. And so I feel like, too, this is where that good data collection, talking with your folks who have the ability to control content and the relationships of, you want to steer clear from, I see that your slides don't have anything, but you want to be free from promotion, not bring any of that conflict in. And then a lot of them too are just very astute about sticking with the topic. And then if other questions happen, leaving that towards the end after the educational session is a good way to go. Jessica, any of your thoughts on that?
No, I think that sounds good. And I agree, it could happen. And so if you're concerned about that, just having a conversation with the speaker and advising them on how they could handle it. But you can't prevent everything. Things happen. So you kind of just do the best that you can. And I would, if it was me, just direct those conversations offline and say, come talk to me afterwards.
Mm-hmm. So here's all those different resolution processes that are on the form itself. So like I said, maybe remove the person from the activity. Okay, so we've decided, okay, we're not going to use that person who is the drug rep or whomever. We're going to have somebody else present that content. Maybe you could change the role of the person. This is pretty much the same as removing them from the activity, really, because if they have the ability to control content, now making them not have the ability to control content. Like I said, offer the activity or session without contact hours. That was what Jessica and I had to do recently with a particular session for an event we're having. We still want to have that content in front of our learners. We think it's going to be a great opportunity. We just can't award contact hours for that session. The nurse planner or a planning committee person talking with that person, reviewing the content. Maybe if the nurse planner is just not sure or wants to make sure that there's a different set of eyes on this particular person's content, have a content reviewer, provide objective input, and like I said, you're going to do that, make sure you get COI data on that content reviewer before you do that. And then please note the next ones are in addition to pre-activity actions. So in addition to either the nurse planner or the content reviewer looking at those slides, those kinds of things, personally attend the activity to assure integrity, making sure that the speaker didn't change the slide deck or her slide deck last minute. Another way is to collect data from learners. I just really caution you against this one. I think for years, and I think it was pre-2015 criteria, that we had questions on our evaluation forms about, was this person biased? Was there a conflict of interest? A lot of learners don't even know what that means. They have different definitions and like we went through at the beginning talking about what a commercial entity is. They may say there was a conflict of interest and they don't even know what that really means. So I just really don't advocate for that last one, even though it is an ANCC thing that you can do. I just have a real cautious towards driving folks to use that one as well. The ones that we use are the nurse planner themselves, talking with the person reviewing the content, and then Jessica and I have plans to sit in on sessions that we're a little concerned about, that we want to make sure that that's true. Now, that being said, what do you do? What do you do in the learning environment? So you might want to stand up and say, hey, it feels like that's getting off topic a little bit here. Can we reel that back in? And one thing you don't want to do is I apologize, my brain just went totally blank. You don't want to hurt your learners, right? If your learners have come to this session, they believe they're receiving contact hours, and then this speaker kind of derails from the plan that was brought, and you're like, oh, I think there was a conflict of interest that was presented in front of, they did promote that company. You know what? That's a conversation with that speaker. That's maybe an apology to the audience, but that does not mean that they don't receive their contact hours. They can still receive their contact hours. And I have made mistakes. I will be fully transparent here. I have made mistakes and not offered contact hours to learners or had contact hours taken away. And I was schooled on that recently, that's not what we want to do. So in the moment, you've done everything prior to the activity. If something goes awry during the activity, like I said, maybe intervening as a nurse planner and saying, hey, let's get back on track, or maybe apologizing to learners in some format if things really went awry or something like that, but still giving the contact hours. Because it's not the learner's fault. So how do we disclose to learners? Oh, I guess I should ask first. Does anybody have any questions about that, about the resolution process? Okay. So then, go ahead.
It sounds like it can kind of grow just by gleaning more information.
Oh, you mean, I apologize. I guess I don't understand. It can grow. Oh, you can do different things.
The process could grow because you might be gleaning different information from different sources.
Right. So okay, good point. So, okay, so we have said, yes, this person has a relationship. Yes, their content. Now we're going to do the resolution process. And we've got this content reviewer, and he's like, hey, I know you talked to that person and they weren't supposed to have this stuff on their slides. That still needs to get cleaned up. So then maybe you go back, you talk to that person again, and then you have to look at slides again. Or, like you say, sometimes everything looks good, and then you get to that session and, oh boy, you're going to have to resolve again. Right. Yeah. So then if you don't have any conflict of interest, then, on every disclosure prior to the learning activity beginning, we have to have three things on our disclosures. We have to have what the criteria for successful completion is, the no conflict of interest statement, and our, approval language. So, such and such institution is approved as a provider, or this continuing nursing education activity has been approved by. So what is that no conflict of interest statement that we should use on disclosures? Here's a couple different examples. There is no conflict of interest for any planner or presenter for this activity. As you know, my favorite is the middle one. There is no conflict of interest for anyone with ability to control the content of this educational activity. No conflict of interest has been identified for any planner for this activity or for the author of the study. The reason I like the middle one the best is it just covers everybody. So what if you use the top one, planner or presenter, but yet you had a content reviewer? Well, you forgot somebody. You forgot to, say that there was no conflict of interest for the content reviewer. So that middle one just covers everybody because it covers anyone with the ability to control content. If you do have a conflict of interest, so you have identified Sharon, who's on that speakers bureau for Eli Lilly, this is how you would go about disclosing that. There is no conflict of interest for any planner or presenter for this activity except for Sharon Green, who's on speakers bureau for Eli Lilly. So when you do have a COI, your disclosure must include the name of the individual, the type of relationship, and the name of the commercial interest. So if you have any specific questions, we can do that now. Feel free to email me if you're watching this as a taped presentation, just kschweitzer@ohnurses.org. Like I said at the beginning, some really good resources are the COI form, the approved provider manual, the conflict of interest decision tree. But I know how sticky it gets, and things come up that you're like, I just don't know about this one. And two, these are great conversations to have with other nurse planners, because oftentimes we get a little confused and we have things that are in that content integrity bucket, but they're not necessarily conflict of interest. But yet it's still really good to talk through those, because you want to make sure that you are free from bias, free from promotion, doing your due diligence in this continuing education work. So are there any specific questions or thoughts right now for those on the call?
Not that I can think of. I like how you mentioned how to kind of corral them or segue back to the topic. That would be helpful if they kind of got lost in it.
Yeah, or I had a activity where the originally planned speaker last minute had to decline the speaking engagement, and the person who was put in their place was found out later to have a COI. So that's where, if those kinds of things happen, make sure you're doing your COI work, and again, probably, here we go, this, the learners have signed up for this activity, here's the contact hours, changing things might be really difficult, but you still want to do that COI collection, resolution, those kinds of things. And then, like you say, if okay, now this speaker, they've got stuff all over their slides, gotta rail them back in here. Yeah. Any other questions?
No, thank you very much.
Oh, you guys are welcome. Like I said, anybody who's watching this on the tape, feel free to reach out to us. We appreciate getting questions like this. We are also available for phone calls. Sometimes it's just easier to talk through specific situations. And, just back to the beginning, if your process is to get a COI form on everyone, that's one way to do it. Or, how we've talked about just keeping it to those activities that are about products that are consumed on or used by patients is completely acceptable as well. You just need to sign that off. You as the nurse planner are sure that there's no way there could be COI, and then you're good to go. So thanks so much for your time. Have a good rest of your day. We will have a link for a post-test and a certificate available when we send the tape of this session. And we're going to send this tape of the session and those links to everyone and have that available for you. And you'll have some time to do that post-test as well. So, well, thanks so much and have a good rest of your day. And just please let me know if you need anything, okay?
Thank you so much.
You're
Bye-bye.
Bye.